Hi, today's lesson is on an intro to inpatient mobility. I'm pretty much just going to begin as if I'm teaching the class um, and hope that this provides a reference and an understanding and a basis for you all to kind of have a flow. While I'm also switching from a educator like the teaching role, I'm also going to switch to throw in tips and tricks into the lesson. So. Hey y'all, so today we're going to talk about inpatient mobility. Could anyone or could you guys tell me what you know inpatient mobility to be, or any guesses or thoughts on what you believe that could be? So after you have now asked them this question, allow an open flow of discussion, encourage the students to participate. I would hope that at this point that probably you've already created a relationship with them. They know you, know them a little bit, and so it would be easy to be able to have a nice flow of discussion. After which, depending on what they say, you can let them know that you guys' thoughts have been on the right track, or if you let them know that the things that they have said, you could understand why they said that, but then giving them the formal definition as to what inpatient mobility to be. And so saying something like, guys, that was awesome. It was a great discussion that we just had, and I heard some great things and great thoughts and great suggestions. And just so that we can ensure that there is a general understanding to what inpatient mobility is. Inpatient mobility is ensuring that patients are admitted in the hospital that have been admitted in the hospital for 2 to 3 or more days are participating in an active mobile regimen to prevent hospital-acquired injuries and diseases. So ensuring that patients that we are working with have a consistent flow as soon as they come in, are moving around, are getting up, are taking walks, are not just laying in bed, but moving from their bed to their wheelchairs or their recliners in their room. Ensuring that our patients are constantly moving around so that we can prevent those easily acquired diseases and injuries while in the hospital. After which you have given them the definition now, then I would suggest that you pass out the handout and discuss the information on it so they can have a visual to be able to refer to and reference throughout their time here at Jesse Brown. So then I would suggest you say something like, so guys, now that we've discussed what inpatient mobility is, I have created a handout for you. That I have a handout for you guys with a general outline of the importance of inpatient mobility and tips. Some things that I would like to personally highlight is the ability of inpatient mobility to reduce patient readmission rates, to reduce the length of time and length of stay, and obviously to reduce hospital-acquired conditions. There are other great ways in which inpatient mobility is able to be helpful while at the hospital. And some tips, some things that I would suggest or have been suggested as ways to promote inpatient mobility as an interdisciplinary hospital. Is that let's ensure that when you're going in and doing your morning rounds or your afternoon rounds as a whole, ensuring that you're asking patients, can you sit up in bed? Why don't we move over to the wheelchair today, or why don't we move over to the room chair? Or leaving nursing orders for the nurses that they should ensure this patient is walking around 3 times a day, if they're able to do such. And even if it's also even possible in the wheelchair, just make sure that the wheelchair is moving around, that people are interacting and being active and being mobile. And then I think one of the biggest ones that people underestimate is utilizing family supports, ensuring that, when family is there, that they're trying to get their family member out of the bed. People are more hesitant to people that work in the health field than they possibly will be to their own family members. So making sure you're having those conversations with family members to ensure that they too, as well, when they're coming in, they are making sure that patients are walking around, are moving around, are getting out of bed, and make sure that these services and things are being done early on. The earlier we can address these situations is the earlier they can be treated. That's the same way as recognizing that PT needs to be given, OT needs to be given. Or that a mobility plan needs to be in order. So, Yeah, so that's just some suggestive ways that I would say that you could present the information to students. However, again, I want to ensure that you are technically using the information provided, but creating your own personal flow to how this information is presented.